So, as you know, yesterday we did a walkthrough of House File 4247 as amended, which is our minibus, as we're calling it, with licensing and scope of practice provisions. So, we're going to start with markup on that bill today. So, I'm going to move that House File 4247, as amended by the DE3, be re-referred to the Committee on Ways and Means. So, being at that place now, we have several amendments that have been filed, and I would like to start by taking up the A4 amendment. And just so members know, we have sort of a series of three more or less technical amendments that I'd like to take up, and then we'll move to the more substantive amendments. So the A4 amendment, so I would move the A4 amendment. This is some changing of dates and some cleanup to the vet tech portion of the bill. And so any questions or comments to the A4 amendment? Seeing none, all in favor of adoption of the A4 amendment, please say aye. Aye. Any opposed? The motion prevails. To the A5 amendment, I'm going to move adoption of the A5 amendment. And this is another technical amendment, changing effective dates. This was a request of the Board on Marriage and Family Therapy to their portion of the bill. And I think it just had to do with their ability to get things up and running by the dates that were in the original underlying bill. So any discussion to this? Seeing none, all in favor of adoption of the A5 amendment, please say aye. Aye. Any opposed? The motion prevails, and the amendment is adopted. And then finally, I would like to move the A6 amendment, and this amendment was brought to us by our staff who, we are so appreciative that they pay such close attention and read everything, and they catch errors occasionally, and that's what this represents, some errors that were brought by the staff. So any questions or discussion to the A6? Seeing none, all in favor of adoption of the A6 amendment, please say aye. Aye. Any opposed? The motion prevails. Okay, thank you, members. So the next amendment would be the A3 amendment, and I think that might be Representative Nadeau.
Thank you, Madam Chair.
Did you want to offer the A3 amendment, Representative Nadeau?
Yes, I'm authoring Oh, I'm sorry, Madam Chair. And I'm sorry I was confused. I was just talking with Representative Edelson, and I'm going to pull that amendment from consideration.
All right, thank you. So that amendment will not be offered. Okay, thank you. Okay, next we have the A2 amendment. Did someone want to offer the A2?
Madam Chair, I will move the A2 amendment.
Representative Schumacher.
Thank you, Madam Chair. This amendment extends the temporary nursing license from 60 to 90 days. We've been hearing back in our communities, Laverne in particular, and from some of our healthcare providers that the nurses that come into the state often will have the temporary license expire before they're able to get their full licensure. And it's my understanding that the Minnesota Board of Nursing supports this, stating that this would reduce the number of instances where a nurse's temporary permit expires before they have completed all they need to obtain full licensure. This would have the benefits for them and their employers, as it would avoid breaks in licensure. We hope that we could see this as a good quality fix for the lives of our nurses, our boards, and our communities, and I hope it's viewed as a friendly amendment. Thank you, Madam Chair.
Thank you, Representative Schumacher. So, I don't know if does anyone else want to speak to the amendment? Okay, so I would ask members to oppose the amendment. I also checked with the Board of Nursing, and my understanding is that they are neutral on the amendment. And there are a lot of problems with this, with doing this. First of all, we didn't have a hearing on it, so it's always difficult when we are doing things on the fly and we didn't have the parties in front of us. And of course, that's an issue of, on any time anybody wants to add new provisions to an omnibus bill like this. But, I'm hearing actually that the Board of Nursing is improving its time to being able to process licenses. And one of the problems with this amendment, which just expands the number of days that someone can work here under a temporary permit, is it shifts the balance in terms of labor relationships with hospitals and nurses, and makes it easier to bring in and have temporary nurses in the state to break strikes and that kind of thing. And while some of you might think that's an okay thing, some others might not think it's an okay thing. And so without a hearing on this, I'm going to recommend a no vote. Representative Quam.
Thank you, Madam Chair. We saw during the pandemic that there are occurrences of where you need to bring in staff for a period of time. And frankly, Minnesota is an outlier in that most states are part of the compact. And we've had difficulty with staffing, as in having enough people to cover and support our needs. So I think this is a reasonable way of trying to bridge until we actually wake up and realize that we should join the majority of the states in having a unified licensure and mobility so that we can quickly respond if need be. So I humbly disagree with your position. Thank you, Madam Chair.
All right, all in favor of the A2 amendment, please say aye.
Aye.
Opposed? No. The motion does not prevail. The amendment is not adopted. And finally, we have the A1 amendment. Representative Nadeau.
Thank you, Madam Chair. I'm far less confused now, so thank you. I'm offering the A1 amendment, which is, it is acknowledging the effort and the progress, the massive progress we've made to increase, patient access to eye care, plus updating a long overdue optometry scope of practice. This amendment is pretty short and simple. It removes some restrictions around injections and medications around oral antivirals and glaucoma. Minnesota is a bit of an outlier, as everyone knows, in optometry care, but this amendment improves access to eye care and makes us far more competitive for people coming out of school. Currently, students in 22 schools across the country are taught, trained, and tested on care and procedures that are far above what our scope of practice allows them in Minnesota right now. So we're finally starting to lose those bright young doctors to other states, including the neighboring states, that all have a better scope of practice. We've become a bit of an island. So finally, members, there's overwhelming support to this amendment. 15 members of this committee have either signed on or are co-author of this bill. I think it's time we move this issue forward. We assist patients in Minnesota who have been waiting for far too long, so I hope people want to talk to this amendment, and I hope we can support it.
Okay. Is there any discussion? Representative Bierman.
Thank you, Madam Chair. Thank you, Representative Nadeau, for bringing the issue up to talk about in this committee. I would really like to find a resolution to this issue this session. I have had this bill for 6 years now, and I'm getting to know optometrists and ophthalmologists quite well. This is the first session, though, where there has been real progress between the parties to find the sometimes elusive peace in the valley, which will be the best outcome. And so right now, I don't want to go into the specifics about the procedures being debated, but will say there needs to be some change made. What I do want to report to all of you is that I've been following the negotiations, and I did hear positive news both last night and this morning that we have people talking, a new offer on the table, and that the Senate sounds like we'll be putting this bill into conference committee. So I am asking that we continue to let the process work a bit longer. We still have options ahead of us, but I thank you for bringing the amendment up.
All right, Representative Bonner.
Thank you, Madam Chair. I will say that on this particular amendment, I appreciate the spirit and the understanding here, and I know that the parties have been working to try to find a path forward for quite some time. In looking at the content of the amendment, there is still one provision in particular that I still gives me great pause, and I've been very public about that in the past. I have real concerns about the impact of intravitreal injections and what that could mean if it goes wrong for the patient. And I think one of the things we always talk about is do no harm. And I have real concerns about that piece. I know the parties are working together to find solutions. And I would also encourage that we let that play out as they continue to have those conversations. So I would urge members to vote no.
Thank you. Representative Quam.
Thank you, Madam Chair. And Representative Bierman's comments are, I guess, I'm glad that there's a discussion, but if that ends up being like past years, would Representative Bierman support an amendment like this on the House floor to the final version of the bill, since we in committee have discussed this, and apparently a large portion of our committee is informed enough to be a co-author. I just don't want to end up having another year of where, they're coming close and nothing happens. So that's my query.
So I would just say that members do not have to answer how they might vote in the future on anything. So Representative Bierman, if you care to respond, you may, but you certainly aren't.
Thank you, Madam Chair. And I will just say the key words in your statement was an amendment like this. And from my conversations last night, the wording of this is not what we're looking at or they're discussing. So I will say, it would depend on the wording, and that is something I do want to pass the bill, as I stated at the beginning. We need a resolution. They're working on some changes, and that's what I will support. Thanks.
Representative Carroll.
Thank you, Chair, and thank you, Representative Quam. To my knowledge, we haven't had a full hearing on this in this session. Perhaps you had previous sessions before I was here, so I haven't had the benefit of hearing all the arguments. So I have been talking with both sides. I appreciate Representative Bierman's approach to this, and I would encourage you to side with him, and we can just continue to work on it. Thank you.
Representative Smith.
Thank you, Madam Chair. And I just felt compelled to speak about this because this is one of those things coming into the legislature I didn't know much about, and then talked to practitioners on both sides in my district, and really enjoyed those conversations. And I do hope for a peace in the valley, as Representative Bierman said. I do share Representative Bonner's concerns, particularly around injection authority. And I do think it's worth saying, because we hear this a lot, that we are an outlier, and we take that case by case, but sometimes it is good for us to have higher standards than a lowest common denominator. We in this committee, all of us, want to protect the people of Minnesota in health scope of practice. And so we need to take these issues by issues. There are things in here that I would support, but I think today, in this particular way, I am going to vote no on that, but I am hopeful that in our conference committee we can get something closer to the middle on this. So I just wanted to explain that, and thank you very much, Madam Chair.
Representative New Brindley.
Thank you, Madam Chair. And just briefly, I want to thank you, Representative Bierman, for working so hard on this issue. And my hope and my encouragement is to say that, yes, we are looking for peace in the valley. That is always the best way to do things around here. But sometimes we don't get peace in the valley until we tell interested parties we are doing something. So whether you choose to come to an agreement, or whether you choose to be on the sideline, we will do something. And I hope that you are demanding of the two sides in this situation. I just use the example, I get it, the folks on this side of the table represent a lot of rural communities. And I will give the example. My father-in-law, once a month, travels 1 hour from his home for injectables for his macular degeneration. He does not have an option closer to home. He is 89 years old. That's why this issue is critical, to figure out what that is, because we have folks, particularly in rural communities, who need access to care. And so I hope you will be demanding with the two sides and say we are doing something. So you can either be at the table or not, but let's do something. Thank you, Madam Chair.
All right, final word, Representative Nadeau.
Thank you, Madam Chair. And just a clarification, Representative Bonner, this amendment did still exclude intravitreal injections. This amendment did. I just wanted to make that clear. And to the body, to the members, thank you for having this discussion. I've learned more about vitreous gelatinous substances than I ever thought possible. But I'm going to withdraw my A1 and thank Representative Bierman for working so hard and continuing to bring these people to the table. I think it's been a good conversation. I think we all recognize that there's things that we need to do, and hopefully we're going to do it this session. So with that, I withdraw my amendment, Madam Chair.
All right, the A1 is withdrawn. And so we are going to be back on the bill. I just would like to comment that this issue is really illustrative of the problem that we face with all of these licensing and scope issues, because we around these tables are usually not experts on these particular issues. We all want to access for Minnesota patients. We all want practitioners to be able to practice and make a living. And we also want to make sure that safety and high standards are maintained so that when people do get care, that it's high quality care that really does what it's supposed to do. So it's often very difficult for us to balance these issues, and I appreciate everyone's coming to the table, because it is best for all if the people who understand this the best figure out the answers so that we all don't make mistakes. That's what we don't want to do, is make mistakes. That's why we want them to tell us what the answers should be. But sometimes people do need a push, as has been stated. Okay, so we are back on House File 4247 as amended. Is there any discussion to the bill as amended? All right, seeing none, I will renew my motion that House File 4247 as amended be re-referred to the Committee on Ways and Means. All in favor, please say aye. Aye. Opposed? The motion prevails, and the bill as amended is on its way to Ways and Means. Thank you all very much.